I'm Dr. Joe Alaimo, and I'm a board-certified chiropractor. My practice has a special emphasis in treating and managing chronic health conditions such as thyroid, fibromyalgia, diabetes, neuropathy, and chronic pain. Today I want to talk to you a little bit about dysglycemia. Dysglycemia, or abnormal blood sugar, is a common thread in all chronic health conditions. Now, we can have blood sugar that's too low, which is called hypoglycemia, or reactive hypoglycemia, which is when your blood sugar drops too low in between meals. Typically, these are patients that will skip breakfast, maybe not eat enough protein, have a light lunch, not snack adequately throughout the day, and allow the blood sugar to drop repeatedly after they eat. So when they eat, blood sugar goes up, and then in between meals, they'll be shaky, lightheaded, irritable, maybe have some brain fog. Does that sound like you? I know most of my patients have some type of hypoglycemia going on. Is insulin resistance, or prediabetes, or metabolic syndrome. All these are when your blood sugar starts getting higher and higher, approaching the diabetic number of 126. So anywhere between your blood sugar being 99 and say 125, we consider that insulin resistance or prediabetes. This poses a whole host of problems in the body, including cortisol surges, insulin surges, and can be responsible for weight gain, abnormal lipid profiles on labs, high cholesterol, high fats. All these things are associated with having too much blood sugar. Also, when it's too high, it can cause neuropathy, which is burning numbness, tingling into your hands and feet. You have an increased risk for cardiovascular disease and stroke. So it's a very serious effect. And diabetes right now has gone up 700% in the last 50 years. So the traditional healthcare model towards managing this condition is typically wait and see until it develops into diabetes, and then we'll just put you on medicine for the rest of your life. To me, that just doesn't make sense. What we do with patients is that we aggressively manage and correct the source of the insulin resistance, why they became insulin resistant in the first place, and then we have to repair their receptor sites for insulin so the patients get better. Doesn't that make sense? I mean, because if you're getting glucose into the cell, you're not going to store it as fat and cholesterol, and you're going to decrease your risk of diabetes and cardiovascular disease. So again, the two different types of blood sugar abnormalities that we predominantly deal with are glycemia, between meals getting shaky, irritable, lightheaded, and brain fog, and then insulin resistance or prediabetes. The clinical manifestation of this is patients have fatigue after meals. If a patient has to have a nap every time they eat something, typically that's due to the glucose being converted over into fat, and that requires a lot of energy on the part of the body. So these patients don't have energy to do other things, so guess what? They want a nap. Good example is at Thanksgiving. Everybody overeats or eats too many carbs, and then we want to take a nap. So I hope you got a little something out of this, and understand that all chronic health conditions have some tracing back to a blood sugar abnormality. And if you don't fix or address the blood sugar problems, the condition never gets better. If you do, there's a good chance for recovery. So hope to see you soon, and I hope you learned something from this video.